this week on the BackTable podcast.
After going through these health issues, I pivoted a little bit more toward using humor for advocacy, in particular like health insurance, probably just like healthcare system issues that we have. I do consider it advocacy because I do have a platform, obviously. A lot of people follow me. And so by addressing this really serious topic, whether it's like prior authorizations or any kind of health insurance shenanigans, by disguising it as comedy, it gets people listening, it gets people watching, and that message is going to reach more people. And then you just put a little truth in there about something that's not so good that needs to change, and your ideas can spread.
Hello, everyone, and welcome back to the BackTable podcast. You can find all previous episodes of our podcast on iTunes, Spotify, and at backtable.com. This is Aditya Bagrodia as your host this week, and I'm very excited to introduce our guest today, Will Flanary, also known as Dr. Glaucomflecken. We're super excited to have you on. We're releasing this across platforms, and it's just a thrill. How are you doing today, Will? How are things?
I'm great. Did you practice that before you said it? Glaucomflecken?
Well,
because you did pretty good.
I think it kind of stuck from medical school. It might have come across my path once upon a time.
There's no way you ever learned that in med school.
Or maybe it was in high school German. It could have been that also.
Could have been.
Well, my wife and I, she's a pediatrician. We're huge fans of the work that you've done, really bringing some levity and humor to our field. It's spot on. I think a lot of people really extract a lot of joy. And actually, there was a medical student here who reached out to me and say, "Hey, did you know that Dr. Glaucomflecken had testis cancer?" And it was kind of a trip. That's my kind of clinical passion, research passion. I spent a lot of time thinking about testis cancer. So I was thinking we could talk a little bit about, your diagnosis, the second diagnosis, your medical history that you've been kind enough to share in some form or fashion, and then how humor's played into all of this.
Absolutely, yeah. Before we get into that, though, I brought this, so I'll just describe what I have here. This is a scrub cap that has little testicles all over it. So this is going to be my urology character outfit, costume, whenever I have time to make some urology content. So I've got a scrub cap covered in testicles, which I think will be very popular with
Are
the
those
urologists.
Testicles with mistletoe on them?
They do. It's a mistletoe themed. It's a holiday testicles.
All right. I'm not going to dig too far into that. Try to keep it PG, but
yeah, I get sent a lot of really strange things from followers. So this was one of the better ones.
I'm almost guessing urology skits are kind of super low-hanging fruit that you've really got to be ready when you go for it.
There's lots of low-hanging fruit in urology. And so, urologists I think have the best sense of humor in medicine, or at least like top 5 for sure. And it's because like you're doing so many very interesting things in your line of work that you kind of have to have a sense of humor, when you're, interacting with patients and doing very sensitive things. So I feel like it's a field that's ripe for comedy. Every urologist I've ever interacted with has a fantastic sense of humor. So I appreciate you guys.
Well, good to hear. Yeah, it's a fun field, and I think there is some intrinsic humor that comes along with it.
But with, I'm sorry, I didn't mean to sidetrack everything. But yeah, so my testicular cancer, although should I say testis cancer from now on? I noticed you said it. I never say testis cancer. Does that make me sound more professional?
No, I mean, absolutely. Testis cancer, testicular cancer.
Does it matter?
No, it absolutely doesn't matter. Let's go with testicular cancer.
Okay.
Let's start at, kind of the beginning. When did you first notice something might be a little abnormal?
Yeah, I was toward the end of my 3rd year of med school, and I was on clinical rotations, and I felt something strange because, men are pretty familiar with their own testicles, I would say. And so, just kind of routine feeling around down there. I was like, oh, that's not normal. There's a little lump there. And I was a pretty astute med student. And so I knew like my testicle wasn't supposed to grow like another testicle. Like testicles don't divide.
That's right.
And so I knew something was off, but it took me like a solid week to convince myself that this was actually a problem. I wanted to explain it away. I was like, oh, that's like the epididymis. No, oh, that's this and that it's okay. Like I don't know. It's going to go away. And it did not go away. And it maybe even got a little bit bigger. I don't know. And so eventually in my own head, I had convinced myself, okay, God, I got to go see somebody about this. Went into student health. I was at Dartmouth, and it was like a whirlwind. It just went so quickly. The physician examined me and was like, yep, we got to send you to get an ultrasound. And that day, like 2 hours later, I got an ultrasound, and the radiologist came and was like, yep, it's cancer. Let me call the urologist. And like 2 hours later, I was in the operating room getting an orchiectomy. It was amazing how quick it went. And I was grateful for that, because I didn't want to, have to just think about what to do and, too much. And so I was happy it moved along so quickly. And that first diagnosis, I felt okay because, I knew that a lot of times it's curable. I have the surgery and I don't have to have any other treatment. And that was the case. I didn't have to have any chemo or any other radiation or anything else. And, everyone told me I'd be able to live a normal life.
Let me ask you a couple of questions, kind of digging into the weeds here. So This is many times how it goes, fast moving train. I felt something, ultrasound, tumor markers, urologist, surgery. And then there's this like weird period of waiting where you're a young person, kind of in the prime of your life, you're a third-year medical student, riding high, all that. And now you're kind of like maybe by yourself. I don't know if you had any support at that time. If you can reflect back on that time, kind of waiting for the pathology, talk to us a little bit about that.
Sure. Physically, it was pretty straightforward. Like the surgery, I recovered okay. I couldn't use my ab muscles for a while, so that was a little bit annoying. But emotionally, there was a big hurdle to get over because, I was in my mid-20s. And I had been totally healthy, never had any problems whatsoever. I was, an athlete and so all of a sudden I had this diagnosis that normally, like I associate with people who are in their 60s, 70s. Here I am as like a mid-20s and healthy person, and now I have cancer. And so there was a psychological aspect of it that was really hard for me to deal with. And I did have support. I was married at the time, and we had our first kid had already been born at that point. She was about 12 months old. And so actually the way I had to figure out how to deal with that, right? And I'm not the best person at like taking care of myself, and that includes my own mental health. And so talking about these things proved to be really difficult, even with my own family. And so I started to deal with it kind of the way I'd always dealt with things, which is with comedy. And through high school and college and into med school, I was doing a lot of stand-up comedy, but I'd gotten away from it for about a year as life just got more, busy doing clinical rotations and everything. But I had this thing in my life I had to try to deal with and come to terms with. And I started writing jokes. I started like just making fun of this thing and my experience and all the weirdness that comes along with a cancer diagnosis. And so it got me back on stage. And that's what I really started to get back into comedy.
Okay. I was going to ask if you've like kind of always been funny, or when did that happen?
Well, yeah. I've been doing comedy for a while.
And then it kind of kicked into gear when you were the butt end of your jokes in some form or fashion.
Exactly. It took a lot of ball for me to get up on stage and start telling jokes about it. But it's, that was really when I started doing medical-based comedy too. Okay. Because up until then, it was just, I wasn't that good at it. No one is really good at stand-up comedy when they first get started. I was funny, but it was a learning experience, and I was getting better at it by the time I was in med school, and I was actually making a tiny bit of money doing it. Very like $20, it's like not much, but And then with the cancer diagnosis, I really started kicking into high gear, the medically themed stuff, because I was in med school and I was like, oh, I could make a bunch. There's so much to make fun of in medicine. So that was really the start of it, I would say.
All right. So I think you touched upon something that, may or may not be appreciated from kind of the provider end, is that, for me, as somebody that deals with testis cancer all the time, that, this is highly curable and there's no stage 4 testis cancer. And I try to be sensitive to my patients when they're going through that whirlwind, and sometimes even pausing a little bit and slowing down a bit. Should we talk about prostheses? Should we talk about sperm banking? Do you want to see a fertility, folks? It sounds like those were probably things that were addressed, and maybe you're like, you know what, I want this thing out like yesterday, and let's make it happen. Can you talk a little bit about that, Will?
Yeah, we talked about fertility, and I don't remember. Everything was reassuring. It was like, you still have one, good testicle. Like we don't need to do sperm banking. So that was, I never felt like that was something I needed to do that first time around.
Sure.
The prosthetic thing, I don't actually think that ever really came up. And I never brought it up. I was aware of that as an option, but it didn't bother me. I was, totally fine, just going half sack. And so, didn't really talk or think about sperm banking that first time. I remember talking about like the need possibly for chemotherapy. That was one conversation I remember having. And so, and waiting for the pathology to come back, and everyone was pretty confident that this is a seminoma. I guess maybe because that's just the most common thing that it was.
Waiting for scans. Do you remember that?
Yeah, like all the scans, and also like I had this fear of like, okay, how many years am I going to be doing these scans? Because like that's a lot of radiation. I'm young, and that was a concern. And I also felt like I didn't get a lot of great answers, like on like what that risk would be, or the data behind like, okay, I've got to do like 5 years of surveillance for a thing that's very, very treatable. It was just all, so I didn't question a whole lot of it because I was like, oh, this is, these are very accomplished doctors. Like they know what I need. And so I kind of went with it. But those were the big topics of conversation, I would say, like surveillance, the need for that many scans over the course of the next however many years it was, and what I need chemotherapy. Yeah. Yeah.
I mean, it sounds like, obviously you're in medical school, you're kind of well-informed. Pretty straightforward stage 1 seminoma surveillance. And you may or may not know this. Actually, this past year, there was a trial out of UK where they looked at 3 scans versus 7 scans and CTs versus MRIs to basically decrease ionizing radiation. And that was a positive trial. So people, I think, are absolutely kind of hearing these concerns of our patients, actually doing stuff about it. So, life is going on. You're a medical student. That's typically pretty busy, other than your 4th year, in my experience. And
I had a great 4th year. It was fantastic.
That was basically one of my top years of my life, where I paid $40,000 to be on vacation. Sick move. Right.
Don't think about that part.
So you kind of made it through. How did you just navigate? You got a kid. You can't pick up your kid. Because weight restrictions. You've got school and like shelf exams. Money. I don't know how you were in medical school. I was pretty broke. How did all this kind of impact you and come together?
Yeah, ironically, it kind of cancer happened at a good time because I was when I had surgery. I think I was in 4th year at that point, so I had the flexibility in my schedule to be able to take like a month off to recover from surgery. And I also have an extremely supportive wife who is Lady Glaucomflecken. Shout out to her. She has been with me through all the drama of my own medical history. And so I can't say enough about the support she's given me. And so, yeah, I was like, laying in bed, it was kind of like rolling over to try to get up. I just remember the discomfort from how hard it is not to use your abs with that inguinal incision. So the other thing with recovery, I remember I think it was that first surgery. They came in after the surgery and told me that there was a nerve that was cut during the surgery that would cause me to have some numbness like on my leg. And I was like really nervous about that at first. It turned out not to be a big deal, but it's like a moment that stuck in my head, like, oh my God, something happened. Well, there's just like a sensory nerve. I don't know. I still have some numbnumness in my like
ilioinguinal nerve. Absolutely. Well, yeah, I'm sure you're thinking there, like, am I going to walk again? Like, am I going to make it, doc?
Exactly.
Kind of in that vein, you're a medical student, third, fourth year, which is conceptually one of the most dangerous times in your life of knowing too much, but actually knowing very little, in my experience. How did that kind of impact things? Did you drive yourself crazy, or did you just kind of say, this is not my wheelhouse? Like, I'm going to trust the people at Dartmouth, obviously kind of a, renowned medical school.
Yeah, it was mostly the trust, because, I knew a lot, but I didn't know that much, right? I mean, I didn't know the ins and outs of treatment. I knew these stats about testicular cancer, and I knew it was a really good prognosis. But when you're getting into some of the details about, what's the infertility chance? What's the chance of recurrence? What's the surveillance schedule? I trusted the doctors on that. I was already in my mind, like on my way to ophthalmology, like that's the type of balls that I was interested in. And so I was like, let's just let the people do their work and tell me what I need. And if it makes sense, we'll go with it.
Yeah. I mean, honestly, as a parent and all of that, when I go into like a pediatrician's office, like I kind of step back and I'm like, I am a parent here. I'm not a pediatrician.
Yeah. Your limits, right? I mean,
yeah. When people call and they're like, important. Hey, my aunt got diagnosed with like breast cancer. I'm like, I'll look into this a little bit. And, but here's some broad strokes ideas.
I mean, like the thing is, like, we know going through medical education, like we can read papers, like we understand statistics. So yeah, we may not know that type of medicine, but like we can have a conversation about it, and we can do research that we can trust ourselves. And so I think that's where kind of the value of going through something like this, but not being in that world, it is still helpful.
That's right. It's like when my advisor tries to sell me crypto, I'm like, I can do a little bit of research here, but not my forte. All right. So, you were probably told somewhere along the way, hey, Will, in addition to your scans and all that, you ought to probably do self-exams every month or couple of months. The likelihood of developing a second testis cancer is pretty small, 2% or so. Let's talk about round 2.
Yeah. No, I was aware of that. And, but I just kind of didn't think about it too much. I was doing my self-exams, and then it was 4 years after the first orchiectomy. I was a resident at this point, about to begin my last year of residency. And yeah, one morning I felt my testicle, and I was like, oh man, it feels like the same thing that happened last time. I knew pretty quickly what was going on. And so I, went in, I think it was on my lunch break or something. I was like in clinic. And I was like, hey, boss, it's on my attending. I just got to run down to radiology to find out if I have cancer real quick. I'll be right back. So that's exactly what I did. I went down there. I was on call at the time, so I was taking day call. So I had the emergency department pager with me. So just if anything came in, it would come to me. And I went down to radiology, had my ultrasound, and just, same thing as last time, pretty much immediately diagnosed with cancer. And then as I was walking out, actually, I got a page from the emergency department. Like I had just found out that I had cancer again, and I get this page of like a patient with a horrible trauma to the eye, and I lost it. I was like, I can't do this. I started crying, and fortunately I had a fellow who was a friend of mine with me, and took the pager from me. He's like, just go home. Like, I'll take care of this. One of the nicest things anybody's ever done for me. And it's exactly what I needed, because medicine teaches us to like work until we're dead, and at all costs, like that's the most important thing. And sometimes you can't do that. You just got to take care of yourself. And that was the situation for me in that moment, because that second diagnosis was a lot harder to deal with, because now I didn't have the other testicle to rely on, right? And so the things that were kind of brushed aside, all of a sudden now I had to face them. So we had 2 kids at that point. What do we do now? Are we done? Is our family complete? I was obviously faced with the idea of losing my other testicle. So do we bank sperm? How much is that going to cost? I had a job now as a resident, but it's residency income. So, and banking sperm is insanely expensive. And so we had to deal with that and answer that question. What about hormone replacement? And what is that like? How much does that cost? It was like a big part of everything was like, how much is all this going to cost? Do I need to postpone residency? And so there were a ton of things we had to try to work through and figure out, just very stressful. And I was very fortunate to be in a supportive environment in residency. Actually, talking about the needing to get the testicle replaced, that was a question I had, a conversation I had with the urologist, was doing a partial orchiectomy.
Yeah. I was absolutely going to ask about that if that kind of came up. And I mean, now we're dealing with rarer situations, partial orchiectomy, post-operative radiation. Is the remnant testicle actually producing enough testosterone and sperm to make it worthwhile saving? It gets a little bit more nuanced here, right?
It was very nuanced. And, I think we also realized, because I had my testosterone levels actually checked before I had the orchiectomy the second time, and I was low, and I had been low for years, and I didn't realize it. I thought I was just tired from
residency and life and
residency.
Kid.
Yeah. And my wife she was actually kind of pissed about it. She's like, did no one think to check? Because I had like 3 oncologists and like all kinds of doctors, over the course of the previous 4 years. Nobody thought to like, hey, maybe 1 testicle is just not enough testosterone. I was told, like, I'm going to make plenty of testosterone. Like, it's going to be fine.
Yeah.
Like, no one ever checked my testosterone level after that first orchiectomy. And so I just explained away my like fatigue, which was really the main problem I had, and irritability as well. Like it was, and Kristen was like, damn it. And no uncertain terms, like this, I knew something was off. And sure enough, she was right. Like I was low and felt so much better once I actually got on the hormone replacement. But the decision to have the partial versus the full, they actually gave me, I think I could have pushed for the partial, and we were pretty sure our family was complete. We had not like totally made that decision yet. So I did want to bank sperm. So that was a decision we decided to do. But I ended up going ahead and just saying, I heard about like what it was like to have a partial, and there's a chance we'd have to go back and just take the other half of it out, depending on what the pathology showed. And so I was like, let's just get it done. Just get it all out of there. And I'm glad I made that decision because it was a stage 1B, I think stage 1. So I think there was like some lymphatic involvement or something. So they told me that I would have had to have the other half of it taken out anyway, or at least that would have been the recommendation.
Yeah,
don't tell me if I'm wrong. I'll just assume.
I mean, for whatever it's worth, it was me, and I spent a lot of time thinking about this. Especially when you have bilateral tumors, a lot of times the idea is there's kind of an underlying testicular dysgenesis syndrome. You probably had some germ cell neoplasia in situ, which nearly certainly would have turned into another cancer, even if it wasn't a recurrence. So I would have put it to rest. And you may also be happy to hear that most kind of contemporary guidelines, NCCN, American Urology Association, now is very explicit as a part of the guidelines to monitor for signs and symptoms of hypogonadism in the kind of follow-up for patients. Whether people are kind of doing that religiously, who knows? But
I hope people do. Because it really could have helped me a lot.
I believe it.
To have that replacement, because I needed it. And looking back on it, I really, I was a tired like med student and resident, but like it could have been easier.
I moved to San Diego from Texas a couple of years ago, and like right before I left, like literally 3 days, I was like, I'm just gonna get some lab work with my PCP. Kind of like yourself, I'm not like seeing my doctor very regularly, and my TSH was like through the roof. And reflecting, I couldn't even get in a pool in Dallas because I would be freezing cold.
Oh wow!
And I kind of mentioned this to everybody in the OR. I was like, it needs to be like 72 degrees, and the postmenopausal obese teammates were pretty unhappy with me. And, here I am now.
That's unusual for the surgeon. The surgeon always wants it colder.
Oh man, I'm like, let's get it hot. Let's get it hot in here. So round two, did you ever reach out to any support groups? In addition, sounds like your family's been incredibly supportive, but there's some pretty good foundations out there. Did you ever take advantage of that?
I didn't, but my wife did for me. And that's another part of that support because she knew I wasn't going to try to, I am a bit of a loner. I don't open up to people very easily. And so my thought process throughout all of this is I can deal with this on my own. I can handle the stress, the emotions, the not trusting my own body, all the things that come with disease, like a disease like cancer. And my wife recognized that. She's like, hell no, you're not. You can't do that. That's not the way this works. And she actually, got on the internet and was trying to find something for me that she thought would be helpful. And she found First Descents, which is an organization for young adults impacted by all kinds of cancer. So basically 18 to 40-year-old, people who have had it, every kind of cancer under the sun. And basically it's an active organization. They do a lot of fantastic work, but they bring together groups of these young adults with cancer to go on these outdoor adventure programs for a week. The idea is it gets you trusting yourself again, trusting your body and realizing that you still have a lot to live for and you can still do a lot. Even though you have this disease, you're still capable of amazing things. And it's just this wonderful support network because that's a group of people that really need it and don't have it because a lot of nonprofits, a lot of the focus is on kids and older adults, and I really feel like a lot is left on the table in terms of support, especially for the 20-year-olds, the 30-year-olds. They're often overlooked in cancer support. And so First Descents is just a great organization that focuses on that group.
Yeah, I'd love to hear that. And just a couple of thoughts and comments. I've been pretty fortunate to be involved with some of the Testis Cancer support groups, the Testis Cancer Society, the Testis Cancer Awareness Foundation, and we do, event where we have patients and caregivers, importantly, join. And, I can't imagine what it's like to have gone through that experience, not just once, but twice. How did your wife do with all of this? I mean, was she just rocking and rolling? I have to imagine it was pretty rough on her as well.
Oh yeah. She's a co-survivor of all these medical traumas. She's, it happened to me physically, but it just as much happened to her because she's going through all of this with me, the recoveries from surgeries, the mental stress, the financial stress. She's a part of it every step of the way. And so she needs support as well. And I tried to give that to her the best I could, and family did as well. But that's another area that I think medicine can do a lot better is giving support for the co-survivors, the family members, the partners who go along this medical journey with the patient who are just as affected, if not more, by everything they have to go through. Yeah. And so it's been tough, but she's incredibly strong and we've gone through it together.
So now you're done. 2 testis cancers. At least you're not at risk of developing testis cancer again.
Yeah, I can't. No, that's off the table.
And I listened to a podcast that you did. Will's got a podcast called Knock Knock Hi. It's really funny, wide variety of topics. And there was, I think it was Dr. O'Riordan, a breast cancer survivor, and you were talking about it. And I was pretty amazed. A couple of things that kind of jumped out. You're like, well, riding a bike, it's super comfortable now.
Oh, yeah.
And I play soccer with the kids and, no concern about getting nailed in the sack. And I was like, good for you, man, that you can really just kind of put that aside and think about it through a different lens.
Oh, yeah. I mean, it's, testicles, you can survive without them. I mean, they're important, but it's, my joke is that they're a little overrated.
Yeah. Well, they make sperm and they make testosterone. You can bank sperm and you can get testosterone. So,
the sperm banking thing, that was a whole new area of learning for me. Not just like the process of making sperm, which is a very strange experience, especially when you're having to do it at your like place of work. But what's interesting, what I didn't realize is like you have the cost of the refrigeration or whatever, but whenever you like hand your little cup of your specimen to the person, surreal experience. But then they ask you all these questions like, do you want your sperm to be transported to the storage facility on 2 separate trucks? Like in case there's some
like
horrific accident or there's a sperm heist and like you lose one of the trucks, like you still have, and that's like an additional $500 or something. It's like all these, I never even thought about that. Like what happens to the truck? What happens to your sperm? That's like the only genetic material that I have left. And so I had to like make these decisions. Sure. And before long, it's like, a couple $1,000 you're shelling out. And I banked sperm probably for about a year. And then eventually we just realized that our family was complete. And so then I had to get the specimen destroyed, which involves like going to FedEx and having one of the FedEx employees who's a notary sign off on my sperm destruction.
Yeah.
I was like, can you, excuse me, you don't know me, but can you help me destroy my sperm, please? So that was an interesting experience as well.
Funny enough, we had some kind of fertility stuff and bank sperm and all this kind of stuff. And you got to send in a notarized letter. And that whole experience ultimately ended up being quite traumatic and not good. And I guess they never logged that we'd signed it, get rid of it, we're done. And I kept on getting these like bills and reminder letters. And it was, like kind of crappy. And, sperm banking is one of those things that kind of gets my goat. The 2 places that I've practiced as an attending are Dallas, Texas and San Diego. And they have high rates of uninsured and underinsured populations. And it drives me bonkers when you have these young men, you're trying to get them through it. And many of them have advanced stage disease, needing chemo and so on. And they can't afford it. That $350 consultation, the $800 kind of cryopreservation fee. And then that's an annual expense. And I mean, it's actually something that people at like the California advocacy level are kind of looking into because it's just a lot. I think that kind of aspect of cancer care.
I was surprised with how expensive it was. I didn't expect that. And I was fortunate to be able to afford it. But, it was expensive enough to make us think, okay, maybe we should just not do this because like we could use that money for other things.
Totally. It's not trivial. So cancer 1, cancer 2. And so how long has it been since your last cancer diagnosis?
That was in 2016. So
for all practical purposes, you're home free, and that's of historical interest only.
I'm
fantastic.
Home free. Yeah. The only, I still see a urologist because of the testosterone mainly. And so that's been the other point of kind of stress at times is figuring out what to do, man. It's not straightforward. There's a lot of options. And that was another thing. Like I don't feel like I was very well informed about what I could do with testosterone. And at first I was on the gel. I hate the gel. The gel's terrible. The daily, you have to worry about, I had small kids. I was like, I can't touch you for a while. I'm sorry. So the gel was just, some people might like it. That was my least favorite.
Not for you.
No. And then I did the injections, like the cypionate, like, weekly injections, in the ass. And that was okay, but wild swings. But I did it for like several years because I thought, oh, this is probably the best option. Like there's nothing else. I'll just do this. It's only once a week. I'll manage it. And it wasn't until I went to speak at a urology conference, like last year. Yeah. I spoke at the Mayo Clinic. They have like a urology conference that they put on.
In Hawaii.
And so in Hawaii, we'll have to say it is in Hawaii. Yes. It's a great conference. So I was out there speaking and talking with a bunch of urologists, and it came up, and I was like, "Oh, I'm doing the injections, much better than the gels." Like, why are you still doing the injections? Like, there's better options out there. And I had no idea. Like, they get the testicle, and you got and I don't have any financial, interest in any of this stuff. Just that I want like good testosterone. And so there's all kinds of stuff, and I didn't realize it, and no one had told me. And I had not had a urologist either. Like I was like, okay, I don't have any testicles. Why would a urologist need to see me?
Yeah.
But that's not the case. And so I got a recommendation for a urologist, and man, the information, like I got that first consultation just about the different options. It was like, oh man, I could have used this like 4 years ago. So there's a lot of options out there.
Yeah. I mean, I think a theme, particularly for testis cancer, which is generally so curable, is that good is the enemy of perfect. Could you have lived the rest of your life getting cypionate? Probably. If it had never been discussed to do a partial orchiectomy. But it's all these little things. We're going to cure you, but there's also ramifications for the rest of your life, and certainly for advanced stage disease. When we're talking about chemotherapy and radiation, there's good data we've published that the actual volume of testis cancer that any given institution sees is directly related to outcomes kind of stage for stage. So I'm glad it's, you're not kind of an andropause level where you finally learned about the different options and that you're on something that kind of works for you. So you're cruising through, you made it through cancer twice, and then you had like another, just sounds like a completely wild catastrophic event.
Yeah, cardiac arrest. That was crazy. That one came out of nowhere. So literally, yeah, it was 4 a.m. on in May of 2020, and my wife woke up to hear me having agonal breaths. So I was kind of gasping for air. She thought I had some kind of respiratory thing. That's what she thought it was, but knew something was off because she wasn't able to wake me up. And so she called 911, and she's not in medicine, by the way. And so the dispatcher recognized that this is probably a cardiac arrest, and so instructed Kristen to start doing chest compressions. And she did 10 minutes of chest compressions until the first responders arrived, kicked down our back door, which was fantastic. And I joke, I've never been so happy to have structural damage to my house before. And they resuscitated me. This is at height of COVID too. So they were wearing all their gear, and
my God,
I don't know how they did it. It was dark. Somehow they intubated me and got an IV in, even though I'd been down for 10 minutes, and took me to the hospital. Yeah. And like I was home, 2.5 days later. It's crazy. My wife saved my life.
That's amazing. I mean,
and we don't know why either. I mean, it has nothing to do with cancer. It's just like another thing. And so I've had every test available pretty much, including genetic testing, and I'm fine.
So you're intubated, ICU, hypothermia, is that right?
They did hypothermia like 24 hours. Yeah. It cooled me down right away. And then that 24 hours, nobody knew anything, what would happen. And then they brought me out of cryogenesis. And
like a medically induced coma, basically.
Yeah. I don't know the details. I'm an ophthalmologist, but
I certainly don't either.
A couple of guys have no idea what we're talking about here. And so, and then, they woke me up, and I was neurologically intact. Pretty
when you woke up, when you first kind of came to, you still had a breathing tube in? You were still intubated?
No, I was extubated by the time. The first thing I remember, my memory is super hazy around like this whole thing, but the first thing I remember was my nurse, Roger, talking to me and asking me questions. And I remember my first FaceTime call, because this is COVID, so none of my family could be in the hospital with me.
Oh my God.
Yeah, that made it slightly more challenging for everyone. And so I remember the FaceTime call with my wife. I wasn't talking to the kids at that point because we didn't, we had to be careful with what we had to figure out how to slowly break all this news to them. And we were.
How old were they at this time, Will?
They were 5 and 8.
Okay. I've got a 6 and a 9-year-old. I can't really imagine having that type of conversation.
Yeah. Yeah. So it was kind of a wait and see. Let's see what the long-term repercussions physically would it be like for me. And then we can kind of let them in on everything that happened. And now they know a lot about it, and they're very familiar with it. They know we talk about it a lot. There's certain things we still have not shown them. Like when we give keynotes, we play the 911 call, which is very powerful and harrowing and scary and all the emotions. So we haven't let them listen to that yet. We probably won't for quite a while unless they want to and they're older. But other than that, we've been pretty open with them about what happened. And I think that's good because we don't give kids credit for their ability to understand and process and recognize things.
Yeah, we had a tough go at about 5 years ago. 5 years now. My wife was 32 weeks pregnant, lost a baby during the induction. Her uterus ruptured. It was like a scene out of ER. Stat,
Oh my God.
take back, pressure bags of blood, and all that. And it was kind of a major life recalibration for all of us. I mean, we lost a baby, and I thought it was quite possible that my wife was going to die also. And there were things that stood out, being on the other side of things, being a patient, that I'll never forget. I mean, one of my pet peeves for any post-op patient is, are they getting Tylenol and Toradol, for instance? She had DIC and couldn't get Toradol. When you've got multiple teams and you're waiting for person A to say, get the breathing tube out, and you can have sips of clears, or your diet can be advanced. What are some of the things that you really kind of remember, and maybe some of the things that were amazing, and maybe some of the things that were particularly offensive being on the other end, anywhere across your kind of fairly extensive medical journey?
Thinking a little bit more long term and talking about those things. I feel like doctors can be very much just in the moment, and this is what the patient needs right now to get better. And then you're better, you can go home, and then that's it. But there's so much more to recovery, especially from major diagnoses or medical events. There's the emotional aspect of things, that mental stress, and medical bills. And there's so much more than just the immediate recovery. And I feel like that's what we're primarily trained to focus on, right? Is get the patient better. And if you're in a field where you have patients that have these serious illnesses, bringing up the idea that, this is going to be, 6 months, 12 months, maybe several years down the road, you're going to have these difficulties. This is what could happen down the road. I recognize the emotional toll this is taking. How's your wife doing? We're talking to if the family member's there in the room, how are you doing? Because it's not just the patient. And so just being cognizant of some of the long-term challenges that if the patient and the family might face, I think is something we could do a lot better.
It just occurred to me, what about going to sleep? Did you have anxiety about going to sleep?
At first I did.
Yeah, I would imagine.
I'm still because I do a lot of traveling for speaking, and I still get a little bit nervous whenever I'm going without my wife, whenever I have to sleep in a room by myself. That's gotten better over time.
Any things that were done that you were just man, I can't believe that happened to me, whether that's, I don't know, little things. Maybe it's a little thing, maybe it's a big thing that you're I will never do that to a patient.
Oh, I think it really, looking back, it was pretty horrific that we were limiting family from being there with patients in the hospitals. I understand it. There's a lot we didn't know about COVID.
Yeah.
But that was legitimately traumatizing, I think, to a lot of people. And so one thing really two things that I took away from this cardiac arrest was making sure I involve family any chance I get. If a patient is in my exam room, by themselves, clearly they didn't come alone, I'd be like, do you want to bring so-and-so into the room with you? Just being more inclusive of family members is a big thing that I focus on now. And the other thing is talking about health insurance. That's really important to, be educated on the physician side of things and not being afraid to discuss cost of things and whether or not the patient's struggling or if a copay is going to be too much to deal with, or, all just finances surrounding health insurance, I think is something we could, that I do a little bit more of.
Yeah. And I definitely want to touch base a little bit on how you've been able to use your kind of influence on areas that you're passionate about. Insurance seems like one of those. Before we do that, quick question. So you kind of mentioned talking to kids. At this point, you're an attending, and it's just I'm out. I've got to take care of myself and my family. I'll see you when I see you, and everybody's supportive. Is that the experience that you had, or was it something different?
very supportive partners. So I've been private practice out here in Portland, and whenever the cardiac arrest happened, Kristen got on the phone with one of my partners and be like, "Hey, Will's not coming in today," and they were unbelievable. They said, "Take as much time as you need," and I ended up taking a month off, which is, in retrospect, was not very much time for given what happened. But I could have taken 2-3 months off, I think, if I wanted to. They would have supported me in that. And so they, everything got put on hold. They saw my patients for me. Obviously, surgeries were rescheduled. And when I came back, I felt 100%. I felt ready to, see patients again. And so it was very smooth. It was important. It was important, I think, that I didn't have to deal with stress of like, how are they gonna deal with this? The reassurance I got from them that everything's gonna be fine, we'll handle things. That just took a little bit more stress away from me so I could focus on the things I needed to focus on in recovery.
Yeah, totally. I mean, when my whole situation happened with my wife, I called my chairman. I've been in academics. I was like, "Hey, Klaus, I'm going to be gone. I'm not sure when I'm coming back. Here's, some detail." And it was all handled. Patients were contacted. I didn't have to do anything. And I think, these are those types of culture things that it may be hard to recognize kind of going into it, but it sure is nice when it goes well.
Yeah, for sure.
And actually, that experience, sometimes just walking away cold, was a nice reminder that sometimes I think we're so embedded and kind of egocentric with our patients and our practice that, hey, listen, the world's going to turn. There's people that can do what I do. You're going to get great care. And it was a kind of a humbling in a positive way experience for me.
Yeah.
Does any of that resonate?
Yeah, I think I've learned a lot. And I think just having that perspective as a patient, I think is really important. Not everybody's going to have that, but I think using that experience to make medicine better for my patients and just, helping them navigate the healthcare system, all that stuff is just, so I try to find the net positive in this horrible situation. And I talk about that a lot, when I speak to groups and stuff. And I think that's, just trying to find some kind of turn this into, something positive, I think has been really helpful for me, psychologically to deal with this.
Yeah. I mean, do you bring it up with patients? Like, hey, do some of them know, or how does that kind of work?
Some of them know, because they've seen me on social media. They ask me how I'm doing, and I always feel a little uncomfortable when they do that, but it's very nice, because they clearly care but I don't bring it up. On rare occasions, I will bring up my cancer history, just because obviously I have lots of patients in their 70s, 80s, 90s. There's a lot of cancer that people, I see patients for routine eye exams, but we end up talking for most of the time about their new lung cancer diagnosis. That has nothing to do with eyeballs.
Yeah.
And that's just the nature of the demographic that I'm treating. And so sometimes I'll bring up my own cancer experience if I think it's relevant. I think it would help, the dynamic.
Yeah. I mean, it sounds like nearly certainly this experience, I guess if there's a silver lining, not that you needed all of that to maybe prompt you towards being a better doctor, where you're dialed in onto some of these things. And now we've got, we've only talked about your medical history and not even kind of touched on how you've been able to bring humor into this and how it's resonated with so many people. And maybe just a bit about how you currently use that platform to advocate for issues that you're passionate about.
Yeah, it's, for a long time it was just jokes. And I was just like, this is funny. Let's just do this. And making fun of different specialties. And I still love doing that. There's a lot of easy targets in medicine, especially surgeons. That is the low hanging fruit of medical comedy, is making fun of surgeons. It's great. But after going through these health issues, I pivoted a little bit more toward using humor for advocacy, and in particular, like health insurance, probably just like healthcare system issues that we have. And I think it's helpful. It's a form of advocacy. I do consider it advocacy because, I do have a platform, obviously, A lot of people follow me. And so by addressing this really serious topic, whether it's like prior authorizations or in-network, out-of-network, whatever, any kind of health insurance shenanigans, by addressing those issues in a, basically like disguising it as comedy, it gets people listening, it gets people watching, and that message is gonna reach more people versus if I just like was sitting in front of this microphone just talking about what a prior authorization is and why it's bad. So I think comedy is an underused method of doing advocacy work, especially in the social media era, because you can reach so many people through humor. And then you just put a little truth in there about something that's not so good that needs to change, and your ideas can spread.
Yeah, I love that. And I'm sure, as a comedian, some part of this is being vulnerable. The first time you get out there, it's like, oh my God, if this tanks, that's not going to be fun. And I mean, one thing I've actually, I think, improved upon just having a podcast is like, I think people want honesty, authenticity, vulnerability, and that resonates more. And, maybe I'm kind of reading into this, but creating jokes, trying to being funny, and then actually addressing issues, there's some vulnerability that's associated with that.
Yeah, I agree, and those are my favorite types of videos to produce, though, is the ones that have a little truth that hurts a little bit, because it's so relatable, but also makes you laugh. That's the sweet spot, I think, for what I'm doing right now.
So as a kind of habitual line dancer, crosser, have any of them kind of blown back in any type of meaningful way?
I mean, I've on every platform, I've deleted something, one thing or the other, because if it just doesn't land the way I want it to land, or it's causing some confusion, or like too many people are just fighting about something that I don't think is important, or it's not the point of the video. But I've gotten to the point now where I kind of know what the reaction's going to be. Like, I know when I'm riling people up. I know when, and sometimes I do that purposefully. Like, I want a little bit of debate. I want people to talk about some of these health insurance things and the challenges we have in U.S. healthcare. And so I know what I'm doing. It's not very frequently now that I am going to put a piece of content on social media and have no idea how it's going to go. Yeah. And I think that's important, because you don't want to be surprised by a backlash.
Yeah. Well, as we're kind of winding down here, I've got 3 final questions for you. So we'll start out with the kind of chip shots here. Advice for patients.
Advice for patients: don't sleep in your contacts. Stay away from Visine, and just understand that ophthalmologists are the best, most accomplished, most handsome doctors out there.
All right, you actually might have answered number 3 inadvertently, but advice for MDs.
Advice for MDs: I would say have a social media presence. There's lots of different things you can do with social media. Some of them are less productive, some are more productive, but I think we need to be on social media because that's where people are. That's where patients are. That's where people get their information. And so we need as many trusted, educated voices as possible on social media. So, it's easy to say, I don't want to mess with all that. Like it's terrible. It's bad. And yeah, there are awful aspects to social media. There are bad things about it, but it doesn't change the fact that, like, for advocacy work, for education, it's really important that we're out there.
I love it. And then lastly, I mean, you've taken a deep dive into essentially all medical specialties. What's the best one?
I mean, come on, man. Ophthalmology, clearly. The ones that I like making fun of the most. I mean, I love doing the therapy videos. Those are fun. That's probably my favorite character to play is the psychiatrist / therapist. The operating room videos are always very popular. People just love making fun of surgeons. I don't know what it is. It's great. I think that some of the egos in surgery, like they're so big that you can't knock them off the pedestal very easily. And so surgeons can take a joke. They don't, whatever. Yeah. I can make fun of orthopedic surgeons all day and they're not going to get mad at me. Same thing with like neurosurgeons, general surgeons. So to all the the surgeons listening, like, I appreciate you because I know I can make fun of you all day and I'm not going to get in trouble. So thank you for accepting my ridicule.
Well, Will, hey, thanks for, kind of getting the word out there for Testis Cancer Awareness Month, for physicians, and how we can really be the best versions of ourselves. And I think on behalf of the medical community, the humor that you bring and allow us to take ourselves a little less seriously is massively, massively helpful. So thank you for your time. Thanks for sharing your story. It's been an absolute pleasure.
Thank you. Good to be here.
Thank you so much for listening. If you haven't already, make sure to follow the podcast, rate it 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable OBGYN on Instagram, Twitter, or LinkedIn. BackTable OBGYN is hosted by myself, Mark Hoffman,
and Amy Park.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles, Nick Shellcross,
and Ness Smith-Savadoff.
Design and digital marketing led by Brian Schmitz, with support from
Taylor's Version Hess and Yvonne Overjinsky.
Show notes and social media by Jody Lenora.
Administrative support provided by Jamila Kennebrew.
Music written and performed by Scott Baby Daddy Hoffman.
Thanks for listening, and we'll see you again next time. The views and opinions expressed by the hosts and guests on BackTable OBGYN are their own, and do not reflect the views or positions of their employers or any entities they represent.